Hey guys, Dr. Brian Wickstrom here with River City Chiropractic, and today we're continuing all our series about knee pain. And so in this video today I'm going to be discussing how knee pain may not be actually coming from your knee. Okay, so the thing to understand is that when your body has any symptom, whatever it is, it's natural warning sign that there's a problem there. It's not healing, it's not functioning, it's not working like it should. And so what we don't want to do is just cover up the symptom. Okay, and so that's, basically like the oil light comes, or a check engine light comes on your car. If all you did was just grab some duct tape and just put that over the light, then you're going to have a much bigger problem on your hands, because you obviously didn't fix and address the root of the issue, which is you're getting low on oil. You just covered up the light and you're pretending that the problem's not there. So sad reality is that that's how most people approach their health here in the United States. And so in this video, like I said, we're going to be talking about where your pain is not always where the problem is. So you definitely don't want to cover up the pain. There's a reason for that, but you also want to find out where it's actually coming from. And so when it comes to knee pain, most people don't think about seeing chiropractors for knee pain. However, the knee pain could actually be coming from misalignments. Could be in your foot, could be potentially in your knee. It could also be coming from your hips. And so I just want to share a quick story of a patient of ours that actually had no spine, no neck complaints, but he was having terrible knee pain, and it was really impacting his sleep. It was keeping him up at night. One of the things that he enjoyed doing was running, and because of the amount of pain that he was in with his knee, every time he tried to go, he make it like a block or two and have to stop. So and so he ended up coming in to see us, even though he wasn't having any spine complaints, but he was dealing with problems with his knee. And so what we did is we looked at his spine, because your spine and your hips are kind of the foundation for everything else going on. And so if there's misalignments up there, then that can cause issues in your knee or also in your foot. So so this is what your normal x-ray should look like of your spine and hips. And that's why we x-ray people, because that way we can see exactly where your spine's at. We measure the changes over time. And so we're not just guessing that you're getting better because you're feeling better, but normally your lower back, your spine and hips should be nice and level from the front. Spine should be straight. And then, so what we ended up finding with this patient that was dealing with the knee pain is that this is his x-ray over here. So his hips were rotated 26 millimeters, which is about 2 or 3 inches. And so because his right hip was so much lower, is actually causing him to develop this kind of scoliosis or curvature down here in his lower back. And so when your hips rotate, that changes your leg length. And when you're running or standing or doing these sorts of activities, you're putting a lot more stress and load on one side than the other. And so repeatedly over time, that's going to cause your knee to get inflamed. It causes it to break down faster. And so what did we end up doing? I never once touched his knee, but what we ended up doing is actually balancing his hips and his pelvis out. And over about 3 months of care, we did his re-x-rays, and we saw huge improvements there with his hips. And he's back out running every single day. Like, he's so grateful because he can actually sleep at night now. And so I just want to encourage you, like, if you're not dealing with any spine complaints, you might be wondering, why in the world would I go to a chiropractor? Well, it may actually be coming from someplace else other than where you're actually experiencing the pain. And so so that's what the first step is, just having a proper assessment done. That's something that we could do in our office if that's something that you want to see, if we can help you out with that. So if you guys have any other questions or concerns, feel free to reach out to us. But I just want to share that story with you guys here today to help you understand that where your pain is not always necessarily where the problem is. And that's one of the things that we look for to help you get to the root of it, and that way you can get well and stay that way. So we'll talk to you in the next video.